Good afternoon, everybody. It's my pleasure to introduce to us today Dr. Costa. He hails from the Department of Environmental and Occupational Health, working mostly over just by the Roosevelt Clinic, he's telling me right now. Dr. Costa originally, it sounds like, did the first part of your training in Milan, then worked briefly in Texas, and then has been at the UW for many years, publishing extremely, pardon?
Many.
I won't go on. Very extensively in the area of toxicology, in areas as broad as what brings about fetal alcohol syndrome to organophosphates, insecticide, and their effect on humans. It sounds like you've even looked into air quality types of things, which might be very relevant to us right now in Seattle, or at least yesterday. And today he will be talking to us about, as you can see, toxicants and their effect on the nervous system. So thanks very much for coming to talk to us.
Thank you.
So thank you for the invitation. I'm very glad to be here. This is the topic of my talk: toxicants, toxins, and the nervous system. And I'll delve immediately into it. The study of what toxicants and toxins do to the nervous system is the realm of neurotoxicology. And I'm a neurotoxicologist. And neurotoxicology is a branch of toxicology that indeed studies the effect on the structure, chemistry, and function of the nervous system, central and peripheral, during development or maturity caused by chemical agents. And just these few words contain a lot of stories here. For example, until about 20-30 years ago, chemical was considered to be neurotoxic only if there were really morphological changes in the brain that you could measure histologically. But currently, we believe that just chemical that causes even subtle alteration in behavior should be considered neurotoxic chemicals. Also important is this distinction between during development or maturity, and as I will show you, there are many differences if exposure to a toxic chemicals occurs during brain development, so in utero or early in childhood or in adulthood. Neurotoxicology also studies the potential role that toxin or toxicants may have in neurodevelopmental, neurodegenerative, and neurological disorders. There are over 1,000 chemicals which are known to be neurotoxic in animals, and about 200 or more are known to be human neurotoxicants. In fact, if you look at all the chemicals for which we have evidence of toxicity in humans, you'll see that 2/3 have the nervous system as their target organ. So the majority of toxic chemicals affect indeed the nervous system. Now, today, I was asked to give you just a general talk about the effect of chemicals on the nervous system. So I decided to take on 2 or 3 vignettes on examples of chemicals and what they do on the nervous system. I have a little stories for all these 3 or 4 examples. And only at the end, I will briefly describe what my current research is, which actually appears to be very current because it's about the effect of air pollution on the nervous system. Scary after the last few days. So I start with the title of an Italian magazine, newspaper. This is Messaggero, the Messenger from Rome. Very old. The date is February 24, 1988. So you can refresh your Italian, but mostly I chose this slide because it has a very local flavor. And the title here says, Signori, il veleno è servito, which means, gentlemen, the poison is served. And the article refers to a TV show, science TV show in Italian television, sort of like Nova on PBS, which was focused totally on the story of 2 Americans who had been poisoned with lead. And the story was pretty interesting because this was a couple. The man was in the Air Force, and he was a military attaché, different consulate and embassies around the world. He spent some time in southern Italy, in Naples, and when he was there, he bought some china in the southern region of Italy, and he used it occasionally, but not very much, because he was kept moving around the world. He ended up shortly in California, if I recall. Then he went to the Dominican Republic, and finally he retired quite young and arrived in Seattle, and that's where he started to use this china a little bit more extensively. And he had started to develop he and his wife started to develop all this toxic sign, gastrointestinal effect. He was diagnosed with porphyria, but the neurotox angle that he started to develop a peripheral neuropathy. I had known this fellow, and he was telling me that he could not hold a pen with his hands. And he went to many doctors to try to find out what was going on, because I told you the China story, but at that time nothing was known. And finally, he was lucky to come here to neurology at UW, and your own Thomas Bird here solved the puzzle. He noticed that all the symptoms fitted with what could be lead poisoning. Now, it was unusual for him to have lead exposure. Nothing was known about the pottery and the china at that time, but that proved to be the source of lead exposure. He had blood levels around 140 microgram per deciliter, which is extremely high. And so, as you can see, Tom published this paper, Porphyria plumbis and the pottery puzzle. And then Don Wallace, who was a U.S. Air Force patient, basically, he and his wife, he came to our department and he started a Master of the Environmental Health program, and all his research was focused on how China pottery could release, under certain conditions of high heat, of acidity, lead. And he then went on a national campaign against warning about these issues with pottery improperly glazed, which was able to leach lead. And went also to Italy. That was the first slide I show you, because the china the pottery he had bought was actually originally from southern Italy. And indeed, in the adult, lead is known to cause a peripheral neuropathy, in addition to other signs of toxicity. And this is specifically myelinopathy. So the Schwann cells surrounding the axon are damaged, are killed by lead, while the neuron remains intact, but the neuron is functionally impaired. So nerve conduction velocity is decreased, as you can see here. With increasing levels of blood lead levels, you have a decrease in nerve conduction velocity. And this is a reversible type of toxicity, and in fact, Dr. Bird put Don and his wife on a chelation therapy, and things resolved in a matter of several months, I think. So this is the first example of how toxic chemicals can affect the nervous system. I want you to also to point out that in the previous slides I had the adult section here about lead, but I also have the child section about lead. And indeed, lead at levels much lower than those known to affect the adults can affect the nervous system of children. And in children, the main target is not the peripheral nervous system, but it's CNS, central nervous system, where we have mental retardation, cognitive deficits and decreased IQ. And indeed, lead has been taken out from gasoline because of this effect on the children. And the concern about lead in paint in old buildings or lead contamination like we had a couple of years ago in Michigan, it's all related to the effects that lead has in the developing nervous system. And this is to highlight this other aspect of neurotoxicology which I mentioned, and which is related to the time of exposure to neurotoxic chemical. And so several neurotoxic chemicals cause effects which are qualitatively and quantitatively different if exposure occurs during the brain development, in utero or in childhood, or during the adult age.
Are you going to say anything about how lead is toxic? How does lead, is it energy metabolism, interfere with a particular enzyme?
$100 million question, because the lead does a lot of things, but the exact mechanism by which it does what you see clinically is not known. There's an interference with energy metabolism, signal transduction, the blood-brain barrier gets affected, and so on. But the exact mechanism underlying all this are still not known. You can see that most chemicals known to be neurotoxic to humans are actually developmental neurotoxicants. And there have been a couple of interesting, important reviews by Phil Grandjean and Phil Landrigan, are two occupational physicians who have underlined just this aspect, that most the chemicals that are toxic in humans are actually developmental neurotoxic. And here are some examples of this. For example, lead, we just saw lead. Methyl mercury is another one. Methyl mercury is a potent neurotoxicant. In the adult, here the effects are similar in the adults and in developing nervous system, but they are quantitatively quite different. You have a limited neuronopathy in adults, but very diffuse and severe neuronopathy if the exposure occurs, for instance, in utero. And this is why you may remember the episode of Minamata Bay many decades ago, where there was consumption of fish contaminated with high levels of methyl mercury, which led to the birth of children severely neurologically impaired, while their mother had very minor signs of toxicity. There are many other examples. One example, which I'm going to touch briefly here, is ethanol, for example, for a couple of reasons. One is that I've been working in the past many years on this solvent, let's call it solvent, and also because the ethanol aspect I'm going to discuss also have a local flavor. Now, in the adult, this is what you have when you ingest different amounts of alcohol on an acute basis, and unless the levels are really very high, usually by the next morning, I would say, you recover your condition. Of course, there are more severe effects that you can see in the adults, in chronic alcoholic, and there are also several neurological syndromes that you can see upon chronic alcoholism. But for the most part, single exposure, even binge exposure in an adult would lead to reversible type of effects. This is not the case when the exposure occurs during brain development. And you all know that exposure to ethanol in utero can be very detrimental to brain development. And the offspring of alcoholics often present a syndrome, the fetal alcohol syndrome, characterized by microcephaly, microencephaly, mental retardation, growth retardation, and particular facial characteristics. This fetal alcohol syndrome was first described by two French pediatricians in 1968, but they published their findings in a French pediatrics journal and was not widely read. And so the syndrome they described was later redescribed and named by scientists here at the University of Washington Harborview Hospital in the early 70s. In one of the earlier papers is this one in Lancet. You see a recognition of the fetal alcohol syndrome in early infancy by Ken Jones and David Smith. And indeed, this is an example of the type of brain damage you can find in a severe case of fetal alcohol syndrome. This is the picture of Sterling Claren, who was a pediatric dysmorphologist here at UW. Here are some data by Anne Streisgood, who did a lot of work on fetal alcohol syndrome here at UW also. And these are the distribution of the IQ in a normal group of 18-year-old individuals and in a group of 18-year-old individuals who had been diagnosed with the fetal alcohol syndrome. And you can see the severe shift to the left of these numbers. They also say that the FAS is only the tip of the iceberg, that there are many situations of so-called fetal alcohol effects where we don't have the whole full-blown fetal alcohol syndrome, but you still have some behavioral abnormalities, mostly CNS type of effect. And since the dose level at which this event are not seen, it is recommended that there is total abstention from drinking during pregnancy. So we have seen already a couple of neurotoxic chemicals. Lead as an example of a chemical causing differential toxicity in children and adults. Same is true for lead. For alcohol, there are really a number of chemicals which are neurotoxic, and they belong to all chemical classes. You can see a lot of the metals are neurotoxic. Lead is one, manganese, aluminum, cadmium, methylmercury, these are all neurotoxicants. A lot of pesticides are neurotoxic. I mean, all the insecticides are neurotoxic because they affect the nervous system of insects, which is not much different in structural component from the mammalian nervous system. And so all insecticides are neurotoxic. And there are also other compounds. There are pesticides are neurotoxic, for example, paraquat, which is an herbicide. Many solvents are neurotoxic. Examples are toluene, styrene, the alcohols. We have seen the alcohol, we have seen ethanol, but methanol is another potent neurotoxin which affects the visual system. Several industrial chemicals are neurotoxic. Acrylamide is an example. Acrylamide is a monomer used for polyacrylamide gels. The polymer is not toxic, but the monomer is toxic, causes a peripheral axonopathy. The PBDs, these are the polybrominated diphenyl ethers. These are chemicals which have been used a lot as flame retardants, and it's possible that these chairs here contain some of the PBDs. They have been used a lot because of the strict fire regulation that there are around the world, but especially here in the United States. And they are not chemically bound to the polymers of the different objects where I added to, and so they are easily leach in the environment. They become widespread pollutants, and in the last several years, they all have been banned because of developmental neurotoxicity. PCBs are also developmental neurotoxicant. This has been banned several years ago. Drugs of abuse obviously affect the nervous system, ecstasy, PCP, and many others. Air pollutants also can affect the nervous system. as well as drugs and natural compounds. So I will want to touch now briefly on the fact that some drugs are also neurotoxic. Then I will show you that a lot of natural compounds are neurotoxic, so it's not that natural equals safe. Actually, the most potent toxins and neurotoxins are natural compounds. And as I said, I will end my talk describing some of the research we have been doing on the nervous system effects of air pollution. Now, you know better than I do that many chemotherapeutic drugs are neurotoxic, and often they induce peripheral neuropathies. And this neurotoxicity is often a limiting aspect in their use and the duration or dosage of their use, together probably with cardiotoxicity. The examples I wanted to briefly show you is the one with thalidomide, because thalidomide is a chemical very important in the history of toxicology in general. It was developed in the 1950s as a sedative, hypnotic, analgesic drug. It was effective also antiemetic, so it was used by pregnant women, and was marketed around 57 and 61, and then was withdrawn in 1961 because it was shown to be teratogenic. And indeed, in Europe, between 10 and 20,000 children exposed in utero to thalidomide were born with phocomelia, so impaired developed arms or legs. And in the US, fortunately, thalidomide was never approved. And the delay in approval was because this officer at FDA, Francis Kelsey, was concerned not so much about the teratogenicity, which was not known yet at the time of the potential approval, but because he had seen case reports of neurotoxicity of thalidomide. And so she stalled on approving the thalidomide in the US, and then all the evidence of teratogenicity came out, and that killed, obviously, thalidomide. I read somewhere that, however, there are some cases of phocomelia also in the US, because at that time, you can confirm if it's true or not, at that time, pharmaceutical companies could give samples of drugs to physicians in the US even before a drug was approved by FDA. And so there apparently were a few cases of when the physician then gave the drug to the pregnant women. There were a few cases of phocomelia also in the US. But this delay due to neurotoxicity basically prevented this big epidemic of birth defects in the US. This event of thalidomide is important for the history of toxicology, because it's from then on that every chemical drug and so needs to be tested for teratogenicity before it can be marketed. And the test occurs usually in the rabbit, which is a species more similar from this point of view to humans. In later years, thalidomide has come back to the market. It has been found to be useful for several conditions, including, for example, multiple myeloma. And here, because of this new use of thalidomide, we have a lot of evidence that thalidomide indeed can cause a sensory peripheral neuropathy with loss of sensation, paresthesia, cramps, slow recovery. There is no animal model. Mechanism is not known. And as you can see, there is a lot of now studies showing that this is the case, that thalidomide can cause this peripheral neuropathy. There is an analog of thalidomide, the lenalidomide, which appears to have less neurotoxic effects than thalidomide. But this is just an example. And as I said, there are many drugs that have as a side effect neurotoxicity. The next issue I wanted to raise is the issue of natural natural compounds, and so natural is not safe. Indeed, the most potent toxins known to man are natural compounds. Think about botulinum toxin. This is by far the most acutely toxic chemical known to man. That doesn't mean that it cannot be used even as a drug. In fact, Botox, very low level and not systemically, finds a lot of use in with plastic physicians and so on, plastic surgery. Tetrodotoxin, it's another example of a very potent toxin. You can find it in, for example, in the liver and ovaries of certain fish, the puffer fish. And if you cook the puffer fish in Japan, you need to be very good and certified chef, because you don't want to leave any tetrodotoxin in the fugu, in the raw fish that you prepare. Tetrodotoxin, it's a potent blocker of the sodium channel, so it blocks action potential, and so basically blocks nerve transmission. Botulinum toxin blocks the release of acetylcholine from presynaptic nerve terminal, so it achieves the same effect of causing basically a block of neurotransmission, especially cholinergic neurotransmission. The examples I want to show you is the one with domoic acid. And here again, little story going back to 1961, the town of Capitola in California, where this event was reported by the local newspaper. So many birds, many shearwaters, they started to fly around, cry like babies, dove into street lamps, they crashed through windows, and they attacked people. And it's believed that this episode is the one who gave the idea for the following movie by Alfred Hitchcock, The Birds. And indeed, even after this episode, over the years, there have been many episodes of animal poisoning in California. Some involved birds. For example, you see Pelican 91, Monterey. Pelicans and cormorants go bizarre. They flop their heads around, flip onto their backs, swim erratically, and vomit. And so many different types of descriptions with different types of birds as well as sea lions. And in all cases, the chemical responsible for this effect is believed to have been domoic acid. Domoic acid has also been involved in a very large episode of human poisoning, and this occurred in November of 1987 in Prince Edward Island in eastern Canada, where more than 100 people became ill after eating mussels. And these mussels, the symptoms you can see were gastrointestinal in nature, but then confusion, loss of memory, disorientation, and also seizures. 4 people died in this episode of poisoning, and about a quarter of the people who were affected developed a loss of short-term memory, hence the name of amnesic shellfish poisoning for this particular syndrome. The fact that this was could be due to domoic acid was identified in a few days after excluding many other possible contamination, but many people didn't believe that it could be domoic acid, because at that time domoic acid was known as a molecule, but it was used as a drug. Was extracted from the seaweed in Japan, and was used to treat intestinal parasites. So people think, well, how could it be that this is involved in all this amnesic syndrome? But as very important concept in toxicology is dose effect, and so the dose of the domoic acid used as the drug was much lower than the dose that these people were exposed to when they ate the contaminated mussels. And the source of domoic acid were the mussels, which were feeding on these pseudonichas, particular pseudonicha pungens, that under certain environmental conditions can produce domoic acid. And domoic acid can then accumulate in mussels, razor clams, scallops, crabs, as well as anchovies or mackerels. And you might know that there are advisories for levels of domoic acid in razor clams, for example, in this area, and if they are above 20 parts per million, then it's forbidden to collect these clams. Domoic acid is an excitatory amino acid. It's a glutamate receptor agonist. It's specific for the glutamate subtype of receptor of kainic acid, the kainate receptor. And so it basically causes an hyperactivation of the kainate receptor, and through oxidative stress and calcium overload, it kills the neurons, and the distribution of neuronal death really parallels the distribution of kainic acid receptors. So these are examples just to give you a flavor of the neurotoxicology, what chemicals do to the nervous system. Now the question is, what about air pollution? I'm glad you asked, because this is what I've been interested lately. Now, where I started from is this. Love is in the air, and I can have the little music here. Okay. It's too... Okay, that's it. Love is in the air. Okay. Love is in the air, but of course, it's not alone. And these are just pictures taken from wherever, from the web, on air pollution. And these two I added yesterday because they are very close to us. You can see. Well, you cannot see anything, basically. You can see. But this is what Seattle was. We were used to this picture as something that
don't pay any attention.
occurs far away. Huh?
We're trying to recruit this guy.
Los Angeles, so it wasn't much of a change.
Well, Los Angeles is worse. So yeah, that has been very rare. They have been very rare. So air pollution, it's a very complex mixture. There's ozone. There are many gases. There are metals in air pollution. There are organic compounds, and there are particulate matter, PM10, PM2.5, and ultrafine particulate matters. And we are mostly concerned with small particles. And to show you how small they are, so this is a human hair. This would be the PM10, so less than 10 micrometers of diameter. And these here, which are this here, these are the PM2.5. So it's very small particle that can really become systemic very easily. Now, obviously, air pollution has been for several years of the interest of people interested in pulmonary toxicology, neurology, and in more recent decades also of interest to people interested in cardiovascular diseases, because air pollution has been associated with both lung and cardiovascular diseases. However, in the last several years, the CNS is also emerging as a target for air pollution, and this is where my interest in air pollution has developed. As I said, these particulate matters are the one we are very concerned about, and we can have systemic exposure and basically inflammation at the systemic peripheral level. But these particles can also enter the brain through the nose and the olfactory nerves and reach even far away areas of the central nervous system. There is quite some evidence now, and from many epidemiological studies, that exposure to high levels of air pollution is associated with a number of behavioral effects, decreased cognitive function, depression, olfactory dysfunction. And the animal studies that have been done generally support all the human observation. Now, in the peripheral nervous system, in the periphery, so in the lung and the cardiovascular system, the main effect found with air exposure to high air pollution are inflammation and oxidative stress. And the same appears to be true also in the nervous system. Oxidative stress and neuroinflammation are also relevant to neurodegenerative diseases as well as neurodevelopmental diseases. And so this is where my interest in this whole area has started a few years ago. We have focused in particular on traffic-related air pollution, which is a major component of air pollution. Now, for the Californian here, in this case, the air pollution is believed to due to fires that occur in eastern Washington, Canada, maybe from California as well, I don't know. But in other parts of the world, it's mostly traffic-related air pollution. And diesel exhaust, it's supposed to be one of the main culprits of traffic-related air pollution. Indeed, diesel exhaust exposure is often taken as a surrogate of traffic-related air pollution. Now, diesel exhaust contains a lot of toxic air pollutants, and it's a major contributor of the small particles, the PM2.5 and the ultrafine particles. Here we can show the levels, these are microgram per cubic meter of PM2.5 in different cities of the world. As you can see, I picked some cities in India and China that have pretty high levels. And Seattle, this was the number I had, and it's about 50, so it's a good city. See, together with, just another example, Anchorage, Austin, Montreal. But these were data from June 10, 2015. This one is from last week. You see, almost 200. So the levels of air pollution were quite high, basically. The record is this one. The record is 1,400 microgram per cubic meter, and was in November 8, 2005, in a city in China. However, yeah.
Do we know that when there's a high level, is there a correlation between the high level of air pollution and these particular compounds that you are pointing out, these particular particles that you're pointing out? That is, we get a measure of air pollution, but
yeah, these numbers refer to the levels of PM2.5.
Oh,
the PM2.5 pattern. Occupationally, you can have quite severe exposures. For example, if you work in a large garage where there are diesel buses, you can get exposed to around 350 microgram per cubic meter. If you are a miner, in certain situation, you can expose up to 1,000 microgram per cubic meter. So this does give you an idea on the numbers. We have a diesel exhaust exposure facility here at the University of Washington in Seattle. It's located at the North Lake, not too far from Ivar's restaurant. The separate, okay. And this facility we can expose animals, mice, like we did in our experiment, but you can also have a possibility of exposing humans to diesel exhaust to do some studies. That's been used extensively for that as well. So we have done some studies on diesel exhaust exposure as a measure of traffic-related exposure, air pollution, and I'm going to show you very briefly some of the findings that we have. This is a work in progress. As I said, it started just a few years ago. So we started with an acute exposure to diesel exhaust. We used mice, and the levels that we chose for this acute 6-hour exposure were just between 250 and 300 micrograms per cubic meter of PM2.5. So a level which is not much different from what you can find in many cities around the world. And what this exposure causes, first of all, it activates microglia. You can find microglia activation in different brain areas. You can find an increased oxidative stress, so increased lipid peroxidation in this case in different brain regions. You have neuroinflammation. There is an increase in the levels of several pro-inflammatory cytokines in different brain regions. And all this can also affect adult neurogenesis. Even this small exposure can inhibit adult neurogenesis, for example, in the subgranular zone, in the dental gyrus, the hippocampus. So a number of, just a simple acute exposure to diesel exhaust at this level can cause all this type of changes in the brain of mice. Not know in humans, but at least in the brain of mice. So this is the first set of experiment that really made us interested in pursuing some research in the area of air pollution and the nervous system. As I said, these were acute exposure. We also started to do some more chronic, repeated exposure. And initial studies, we focused on developmental exposure. This is because in the literature, papers have been appearing associating exposure to air pollution with an increased risk of autism-related disorders, autism spectrum disorders. And these are some of the epidemiological studies that found this association. So, you know about autism, which is characterized by marked reduction in social and communication skill, presence of stereotype behaviors. You know that the incidence seems to be increasing for some reason. It's more prevalent in male than in female. And inflammation, oxidative stress, and some brain malformation are present in children diagnosed with autism. The etiology is unknown. There is certainly a genetic component, but there is also evidence that environmental factors may be involved. And air pollution is appearing to be one of the main ones that have been studied at least. So we conducted a study exposing mice to diesel exhaust, same level as before, but from day of conception, gestational day 0, to postnatal day 21. And we found that this exposure had no effects on pregnancy, birth, litter size, body weight, so it was not a developmental toxicant, but it causes selected behavioral alterations in the behavioral domains which are relevant for autism, and so which are persistent repetitive behaviors, communication, and sociability. So we feel that these experiments, which were recently published, could establish a model for air pollution exposure which may be relevant to study then its relationship to autism. And we have a working hypothesis on what could be the mechanism underlying these effects of air pollution, diesel exhaust on brain development and autism-like behaviors, which starts with the neuroinflammation, so increase in IL-6, changes then in certain signal transduction pathway, changes in epigenetic changes in DNA methylation, ending with altered expression of reelin in the cortex, and also altered brain structure morphology. And we have done some studies with about structural layering of the cerebral cortex with Bob Hebner, who just left the university a few months ago, showing that we find in these animals the same type of changes in the layering of the cortex that are found in autistic children. The other final aspect that I think is very interesting is also the possible association between air pollution and neurodegenerative diseases. And here again, there are a number of papers that have associated exposure to air pollution to Parkinson's disease and mostly Alzheimer's disease. This is where the evidence is stronger. And this is just a list of some of the studies that have been published in this area. And this is just some initial data that we found. This is a 10-week exposure of mice to diesel exhaust, and you can see that we have an increase, for example, in phosphorylated tau in the cortex of these animals. There is an increase in alpha beta 42, amyloid beta 42, an increase in alpha synuclein, in DYRK1A, which is a kinase involving signal transduction, thought to be relevant to neurodegeneration. And here we just show that there is a neuroinflammation, increase in markers and cytokine, neuroinflammatory cytokine, and also oxidative stress. So this is just initial data suggesting that it may be worth doing, given all the epidemiological evidence, be worth to study in a more controlled environment, air pollution and neurodegenerative diseases. So to conclude, hopefully in time, I just wanted to briefly show you that there are hundreds of chemicals, including natural compounds, that can exert adverse effects on the central or peripheral nervous system. So neurological manifestation may be associated to specific chemical exposure and or to gene-environment interaction. That's another important consideration that one should do. The fact that the developing nervous system has unique sensitivity to neurotoxic insult, and the fact that some of the neurodegenerative or neurodevelopmental disorders may be due, at least in part, maybe with the gene-environment interaction component, to exposure to neurotoxic chemicals. These are the people that help me in the type of research data that I show you, and these are the funding agency. Thank you very much for your attention.